A urinary tract infection is a painful condition that could affect your urethra, your bladder, or your kidney, and one of many conditions that could affect your excretory system. This lesson is on the regulation of kidney function. So the amount of water reabsorbed from the filtrate into the blood influences two characteristics of blood, both its volume and the plasma solute concentration. The solute concentration of blood and its volume must remain constant despite changes in our environmental conditions. So do we drink a lot of water? Do we eat a lot of salt? Do we perspire? And so this is going to be maintained through a system of homeostasis. Special receptors called osmoreceptors are found in the hypothalamus of the brain, and they're going to pick up changes in solute concentrations of our blood. So is our blood more or less salty in essence? If you're dehydrated, the osmoreceptors are going to send a signal to the pituitary gland to release a hormone called antidiuretic hormone, or ADH. Antidiuretic hormone travels to the distal tubule and the collecting duct of the nephron. Now, these are the last two steps before our filtrate is sent to the ureter. Antidiuretic hormone causes these tubules to become more permeable to water. In the influence of antidiuretic hormone, more water is then going to be reabsorbed back into the blood, diluting the blood and retaining water in times of water loss. The reverse occurs if blood solute concentration is too low. Antidiuretic secretions are going to be prevented from being released from the pituitary, and more water is going to be excreted into our urine. So our urine is more dilute. Alcohol and caffeine act as diuretics, and they block the release of antidiuretic hormone. So these substances are going to decrease the permeability of the tubules to water and cause more water to be excreted in the urine, even though our solute concentration in our blood might be higher. So here's a flowchart for antidiuretic hormone. Osmoreceptors in the hypothalamus detect high solute concentrations in the blood. The pituitary gland receives messages from the hypothalamus and secretes antidiuretic hormone. Antidiuretic hormone increases permeability of the tubule walls to water, so it's able to travel back into the blood from the nephron, and the urine becomes more concentrated. The blood becomes diluted, and your antidiuretic hormone production is stopped. Aldosterone is another hormone that affects the reabsorption of filtrate. Aldosterone is produced by the kidneys and affects the permeability of the tubules to sodium, potassium, and chloride, so ions. By reabsorbing these ions, the osmotic gradient gets set up and water passively follows back into the blood. So by increasing the permeability of the tubules to ions, we're allowing water to passively flow back into the blood. The kidneys can also regulate our blood pressure by changing the volume of the blood. Special receptors of the glomerulus, called juxtaglomerular apparatus, detect blood pressure. If too much fluid is lost and blood volume goes down, so does blood pressure. The JGA is then going to pick up the low blood pressure and release an enzyme called renin, which changes the inactive protein angiotensinogen into the active hormone angiotensin. Angiotensin causes the kidneys to release aldosterone and cause vasoconstriction or constriction of the blood vessels. Aldosterone is going to cause reabsorption of sodium, which leads to more water entering the blood, which increases blood volume. Vasoconstriction is also going to cause the diameter of the blood vessels to decrease, which causes blood pressure to increase. So we increase our blood pressure in two ways: by reabsorbing more water into the blood volume, and to constrict the blood vessels to cause blood pressure to go up. So low blood pressure is picked up by the JGA and the glomerulus, which releases renin, which converts angiotensinogen to angiotensin. Blood pressure is then going to be increased due to vasoconstriction, and the aldosterone secretions, which increase blood volume, also increase blood pressure. So now looking at urination. So at least 500 milliliters, or 2 cups of urine, must be released every day because of the amount of fluid that's needed to remove potential toxic materials. So that's the amount of urine that we must release so that our toxic materials are diluted enough to not cause harm as they're contained in our bladder or released from our system. Generally, a normal adult will eliminate 1.5 to 2.3 liters of urine per day, depending on the amount of water taken in and the water lost through respiration and perspiration. So urine leaves the bladder because of the micturition reflex. The stretching of the urinary bladder triggers the micturition reflex center located in the sacral portion of the spinal cord. This returns a parasympathetic impulse, causing waves of muscle contractions, and the urge to urinate is sensed. When the contractions become strong enough, the internal urethral sphincter is forced open and urine enters the urethra. The external urethral sphincter is under conscious control most of the time. So we have the internal urethral sphincter, which is not under our control, but the external urethral sphincter is under our control. So finally, we're going to wrap up by taking a look at a few different urinary disorders. So one of them is dehydration. So if our kidneys aren't functioning properly, we're not going to absorb water properly, and our body will begin to lose more water than we can replace it. So this can happen because we've had diuretics such as coffee, tea, or alcohol, not consuming enough water, or having other conditions like diarrhea or vomiting where we're losing water through other ways, not just our kidneys. Kidney stones can be caused by substances such as uric acid, calcium, and calcium phosphates that are not completely dissolved in the water. Normally, the solid particles aren't noticed because they're excreted in very small quantities and likely coated with special proteins. But in some people, this coating is not working and the solids grow up to be the little stones, which are then called kidney stones. And they can be extremely painful because they'll block the flow of fluid through the kidneys, as well as they can be painful as they're passed. So here we can look at different kidney stones. Here's a cross section of a kidney. There's a kidney stone inside the kidney, and it can be at any point in your system through the ureter, the bladder, and some people pass them through the urethra. Gout is a condition where we have a buildup of uric acid in the blood, and it causes uric acid to crystallize in the joints, which causes extreme pain and swelling. And this can be treated with diet, water, and there are some drugs as well. Another disorder of the excretory system is known as diabetes insipidus. Now, this is not a blood sugar related diabetes, but this is a disorder where antidiuretic hormone production is lower than it should be. So the kidneys aren't being told to reabsorb lots of water. So the volume of water released through urination is greatly increased and is accompanied with large amounts of glucose just because the water isn't being reabsorbed and the glucose is also not being reabsorbed. Urinary tract infections can occur in the urethra or the bladder, and this can be caused by viruses or bacteria entering the urinary tract, causing inflammation, burning, pain. It's more common in females because the urethra is shorter and in much more closer proximity to the anal opening. Typically, they're treated with antibiotics, and typically they do need to be treated, whether you're treating it kind of naturopathically or through a medical doctor. So if your kidneys are completely failing or about to fail, one of the ways that we can treat issues is known as kidney dialysis. So blood is pumped out of the body into porous tubes made of semi-permeable membranes that replace the nephron function. So these tubes are going to pass through a solution that's designed to draw waste products out of the blood by diffusion. The concentrated waste is going to be moved into the water bath, cleaning the blood. And other substances can be added to the water bath in concentrations greater than in the blood, so they can be moved into the blood if needed, such as bicarbonate ions to act as a buffer if the blood is too acidic. So here's an image of kidney dialysis, where we have a line from an artery to a pump where it's going through that selectively permeable membrane and a water bath. We have fresh dialysis solution, and then the used a dialysis solution with the excess urea salts and wastes from the blood, and then the clean blood is returned back to the body. So this allows people to live with the loss of kidney function, but they have to go to the hospital on a daily or semi-weekly basis. If a person ends up losing more than 90% of their kidney function, they're going to have to get a kidney transplant, but they have a very high success rate. Unfortunately, there are very few registered donors. However, people can function with just one kidney. So often people will have a kidney transplant from a family member or a living donor who matches them. And then both of them would only live with one functioning kidney. Typically, high blood pressure is one of the leading causes of kidney failure because the high blood pressure can damage the delicate filters of the nephron, and then our nephron is not going to function properly. Okay, well, that's the end of our chapter on excretion. Thanks for joining.